Questa è una sessione che affronterà fondamentalmente il tema del plasma e dei medicinali plasma derivati e quindi plasma come risorsa strategica, perché è necessario parlare di farmaci plasma derivati in un contesto che affronta il tema della donazione soprattutto con questa enfasi e sottolineatura sulla donazione volontaria non remunerata, quindi escludendo ogni tipo di remunerazione. Quanto è possibile conciliare l'esigenza etica della non remunerazione con l'esigenza di garantire a tutti i pazienti con delle terapie qualitativamente adeguate ma anche quantitativamente adeguate e disponibili possibilmente in ogni angolo del pianeta. E questi sono temi che sicuramente ci impegnano, ci sfidano, che impongono una riflessione comune e allargata a tutti i soggetti che in questo ambito sono portatori di interesse, quindi anche appropriatamente e diciamo virtuosamente le associazioni dei pazienti. Chiaramente il primo obiettivo è quello di avere terapie disponibili e garantite, però non dimenticando l'altro aspetto che dobbiamo presidiare. Abbiamo 2 interventi in videoconferenza, comincerei a verificare il primo collegamento con il dottor Farrugia, che si collega da qualche remoto angolo del pianeta dove è impegnato da Taipei. E c'è anche il dottor Roberto che vediamo già collegato. Io credo che tutti conosciate il dottor Farrugia, che è professore alla scuola di chirurgia dell'Università della Western Australia e consulente collaboratore scientifico di aziende produttrici di farmaci plasma derivati. Io affiderei immediatamente la parola sul tema medicinali plasma derivati. Quali evidenze della loro necessità? Albert, a te la parola.
Can you hear me?
Sì, ti ascoltiamo.
Va bene, it's not important that you see me, but it's reasonably important that you hear me. Grazie mille, caro Pierluigi. Buongiorno a tutti, saluti a tutti gli amici, tutti i colleghi e spero che il tempo a bella Roma è meglio del tempo a Taipei perché avvicina un typhoon e io spero che è possibile che io parti di questo paese questa serata più tardi. Scusa il poverissimo italiano. I'm sorry, I couldn't resist saying a few words in Italian. I salute everybody and I'm sure that you've got better weather than I have. Can I have slide 2, please? Well, I hope you've got slide 2. And as has been said, I have a relationship to the commercial sector and I want to thank very much the organizers, especially my friends Giuliano Grazzini and Giancarlo Riumbruno for their collegiality in inviting me here. It is my established practice that I emphasize that any views in this presentation are my own and are not reflective of any of my affiliations. I do this in order to try to keep out of trouble. It never works, but I feel I am obliged to do so even on this occasion. Can I have slide 3, please? And as everybody did in their initial salutations, I wish to thank very much the donors, the blood donors all around the world. I salute them all on this very important occasion. I salute in particular the donor associations represented by Fiods, president of which has already spoken. I salute the Italian donor associations, so very important in maintaining the blood system in our country. And I salute as well all the organizations which has been emphasized in the introductions are working hard to ensure that we have human and material autosufficienza, self-sufficiency in blood and all its derivatives, and that Italy continues to fulfill its international mission as required by the World Health Organization to, as much as possible, maintain the ability to supply and manufacture and keep patients satisfied in relation to the various illnesses which are provided through the essential raw material, which is blood. I want to emphasize as well, as I did in an editorial I wrote on the occasion of this day 7 years ago, that it is important to recognize, in terms of the subject of my talk, the donors of plasma, wherever they are coming from, because if it wasn't for them, we would not have the essential products needed for the illnesses, some of which I will describe. I hope that someday this will eventuate and we will have an apt recognition of all these donors. Can I have slide 4, please? Before I turn to the subject of the individual plasma derivatives, I will, I think, review for you briefly the history of plasma fractionation. You can see here one of the all-time heroes of our field. This is Professor Edwin Cohn, a great man, a great public servant for the United States, but also for the world. He was a skilled biochemist who isolated many of the plasma proteins during the 1930s, and during the war, he was asked by the US military to develop a stable plasma expander which could be stored and transported in the arduous battlefield conditions of the Second World War. Apocrypha tells us that he was asked to produce a product which could be stored in a tank in Tobruk. He developed on a large scale an industrial process which could be used on large volumes of plasma, and his famous scheme, based on the precipitation of albumin using ethanol added at low temperatures and varying other parameters, such as the pH and salt concentration, gave us a process which has withstood the test of time and which we still use in some shape or form today. This sequential precipitation treated plasma analogously to oil being refined, resulting in purified proteins as the sequence was progressed to the final product which Cohn was charged with, which was albumin. Cohn's work and others had already showed that the plasma expanding role of albumin could contribute the properties which the military required. The albumin thus produced proved very effective in resuscitating battlefield casualties, including one of its first uses in treating the victims of the attack on Pearl Harbor. Can I have slide 5? The basic Cohn principles of manipulating protein concentration, pH, ionic strength, temperature, and ethanol concentration have survived to this very day. Although, as the need for albumin has given way to other proteins which could be harvested, modifications and additional separation methods, such as chromatography, were introduced, some of them relevant to the primary protein today, which, as I shall discuss, is immunoglobulin, are shown on this slide. Slide 6, please. The industry, which was spawned by Cohn's work and other workers, has proven to be remarkably robust and profitable. Plasma fractionation results in a number of strategically crucial medicines for the healthcare system. Hence, the capacity to generate these medicines is very important for a country's strategic independence, especially in times of potential stress, and God forbid, if the world is at war, every country needs to be able to, at some stage, generate its own medicines, which are essential in terms of acute as well as chronic applications in medicine. I should perhaps at this stage recognize my co-speaker on video conference, Patrick Robert, the founder of the Market Research Bureau, which for the past over 30 years has provided this industry with the data which it needs to be able to effect strategic planning. And on this slide, provided by data from the Market Research Bureau, you can see the remarkable expansion of the plasma industry during my career. Can I have slide 7, please? Slide 7. Okay. The industry has been characterized by a number of so-called drivers. Sorry, previous slide again, slide 7. Okay. The industry has been characterized by a number of so-called drivers which indicate the particular protein, the needs for which determine the volume of plasma which has to be collected to ensure that demand is met. This, in other words, is the driver or the bottleneck protein. For the first 30 years, albumin continued to be the dominant fraction harvested, responsible for the largest component of revenue and for driving the procurement of plasma. Can I have slide 8, please? Next slide. Thank you. This slide shows the structure of albumin, and the therapeutic use of albumin has evolved as its biochemical and physiological properties have become more understood. The initial use of albumin as a plasma expander depended on its properties as a protein responsible for providing most of the oncotic pressure of plasma, maintaining plasma volume and circulatory function. This aspect of albumin's function was responsible for its therapeutic effectiveness in patients requiring rapid resuscitation, but has tended to lose some of its importance as modern resuscitation protocols using other fluids have become established. However, as the characterization of albumin has revealed a wide range of activities, particularly its antioxidant and anti-inflammatory properties, other therapeutic roles for albumin have evolved, and these have involved diseases such as sepsis and cirrhosis, where these functions of albumin are particularly compromised. May I please have slide 9? As the principles of evidence-based medicine were brought to bear on the plasma industry, the resuscitative capacity of albumin in modern practice has been called into question as compared to other fluids. This has led the Cochrane collaboration to conclude that resuscitation with colloids, including albumin, is therapeutically equivalent with the much cheaper crystalloids, using the resuscitation protocols which modern acute care has evolved. While this subject is contentious and subject to considerable debate, it has definitely contributed to a shrinking market for albumin solutions formulated to 5% albumin in Western practice, although a brisk market is still present in the United States and crucial for the modern industry also in China. May I please have the next slide, slide 10. Thank you. However, many of the biochemical properties of albumin described above in the previous slide could be linked to beneficial effects in conditions such as sepsis. The circulatory problems arising from sepsis could be targeted by albumin in several ways, as shown on this cartonic representation. A number of studies have shown that this can be demonstrated in vitro and in animal models, but these, of course, need confirmation in clinical trials in patients. Slide 11, please. Next slide. This receiver operating characteristic, ROC curve, and incidentally I have neither the time nor the knowledge to explain it in detail, basically shows that low albumin levels, hypoalbuminemia, are associated with both increased mortality and multiple organ dysfunction syndrome, known as MODS, in patients with sepsis. Hypoalbuminemia is a strong predictor of mortality in several diseases, but this of course is not necessarily indicative of a beneficial effect of infusing albumin solutions, which, as I said, bowing to evidence-based medicine, has to be addressed through clinical studies. Can I have slide 12, please? A number of large so-called pragmatic trials have assessed the role of albumin in sepsis in the past 15 years. The SAFE study in Australasia, the EAR study in France, and the ALBIO study in Italy have all studied this therapy. Interestingly, these large pragmatic trials consistently show the beneficial effect of albumin infusion on survival, and the pre-specified subgroup in the SAFE trial did show a significant effect. However, albumin infusion did not show a benefit in the overall trials. In the ALBIO study, performed in severely septic patients in Italian centers and funded by the IFA, and I take this opportunity to salute the IFA for consistently funding these very important publicly required clinical trials. In the ALBIO study, a post-hoc analysis showed a beneficial effect in septic shock, which achieved significance, although the post-hoc nature of the analysis deflected its importance. And the relevant journal, which was the most important one in academic medicine, the New England Journal of Medicine, in a somewhat purist attitude, refused to allow the conclusion, because of this reason, to be shown in the paper's conclusions and abstract. May I show the next slide, please? Slide 13. 13, slide 13. Grazie. Primarily because of the ambiguous outcomes of these trials, the guidelines of the Surviving Sepsis campaign are somewhat muted in their endorsement for the use of albumin in sepsis. It is my view that further trials targeting specific patient groups would be more useful than large pragmatic trials. In the area of personalized medicine, effects based on multi-gene interactions such as those observed in sepsis demand a more refined approach to tailoring a therapy such as albumin to a specific patient. May I have the next slide, please? 14. Grazie. The other area where albumin-specific and non-oncotic effect have yielded increasingly promising therapeutic results has been in hepatology, where early findings using albumin as a volume expander following paracentesis have been augmented with findings in other groups of patients, including spontaneous bacterial peritonitis and the hepatorenal syndrome. These findings have culminated in the large-scale trial known as the ANSWER study, which has just been published in The Lancet. In this study, again funded by the IFA, long-term albumin administration in patients with decompensated cirrhosis had an unambiguous benefit on survival in patients, and a large swathe of other benefits were recorded, as you can see on this slide. You're seeing here both the effect on mortality or survival and the effect on other very important healthcare parameters, including an enhancement on patient quality of life. And in addition, the use of albumin in this patient group has been shown to be highly cost-effective in the standard methodology of pharmacoeconomics. Next slide, please. Next slide, 15. Bene. As a final point regarding the most venerable of plasma products, albumin, I would make you aware that albumin solutions must not be assumed to be uniform in properties between manufacturers. As may be seen from these studies on the effect of albumin on properties such as endothelial adhesion and binding of drugs, different products exert different effects. And this, for us in the industry, is not unexpected, as albumin manufacture, like all biological products, varies in detail between manufacturers in ways which may affect the biological properties. The principle of the product is the process has long been urged by industry and regulators, but albumin continues to be viewed as a commodity, a regrettable position given the complexity of the molecule, which I have emphasized. May I have the next slide, please? Although early preparations of cone fraction 1 had been shown to be useful in treating hemophilia, it was only when further knowledge of the disease, including the differentiation of hemophilia A, factor VIII deficiency, and hemophilia B, factor IX deficiency, knowledge on the properties of factor VIII, and above all, the demonstration of cryoprecipitates use by Poole in the 1960s, that plasma product therapy for hemophilia became possible. By the late 1970s, the need for factor VIII concentrate had made this product the driver for plasma, particularly fresh frozen plasma procurement. Next slide, please. Grazie. The availability of factor VIII, first from plasma and subsequently from recombinant sources, has probably been the greatest achievement in the plasma industry, in that it transformed the life of a whole community. From a pain-filled and short life, people with hemophilia attained a normal life expectancy and a quality of life within a span of less than 20 years. Despite the tragedies of the viral epidemics, this achievement cannot be underestimated. This data from the World Federation of Hemophilia's Global Survey shows how increasing factor VIII provision leads to a higher observed prevalence, as increased survival affects the patient demographic. As the prevalent levels off, increased provision impacts more on patient quality of life through prophylaxis, tolerization, and other modern interventions in addressing this disease. Next slide, please. Although in the wealthy countries, most of the factor VIII is delivered in the form of recombinant product, a demand for plasma-derived factor VIII has continued and is in fact higher than when recombinant concentrates were introduced more than about 30 years ago. This is shown on this slide, again courtesy of the MRB. In the less wealthy countries, plasma-derived factor VIII is sold at a considerably lower price than recombinant, a somewhat incongruous situation as the actual cost is greater, but companies allocate costs to other products in order to retain sales. In the established countries, the use continued of plasma-derived factor VIII has come about from the provision of von Willebrand factor, which is co-purified with factor VIII. In addition, plasma-derived factor VIII has been retained as a preferred product by treaters seeking to tolerize patients who have acquired inhibitors to factor VIII as a result of substitution therapy, and this area I will spend some time on because it has become increasingly important. Can I have the next slide, please? Prossimo. Grazie. Following the elimination of pathogen transmission risks from hemophilia treatment products, the generation of inhibitors to factor VIII has emerged as the most significant adverse event in hemophilia in modern practice. Mortality and morbidity in patients is significantly increased, and this is found in up to 1/3 of patients when first exposed to treatment. It can be truly said that the generation of inhibitors is catastrophic in a patient with hemophilia. May I have the next slide, please? Early on in their use, a growing body of observational evidence has indicated that recombinant factor VIII concentrates were resulting in a higher incidence of inhibitors to factor VIII than had been expected through historical experience using the plasma-derived products. This issue has continued to be debated and has continued to be very controversial, and in the absence of a yardstick study in the form of a randomized trial, the question remained until very recently. May I have the next slide, please? Prossimo, grazie. Again, proudly, as somebody associated with the Italian community, I take great pride in reporting that in 2010, another crucial trial was proposed in the form of the CIPIT study, which randomized previously untreated patients to first treatment with plasma-derived or recombinant products. The plasma-derived products used were factor VIII von Willebrand complex concentrates, while the recombinant products were the first generation factor VIII recombinant products generated from rodent cell lines, which lacked von Willebrand factor. The study was coordinated by the eminent group of Professors Manucci and Peivandi in Milan, involved many centers around the world, and was carried out over the early 2000s and published in 2016 in the New England Journal of Medicine. The results indicated a significantly higher incidence in inhibitors to factor VIII in patients given the recombinant products. This study's publication has renewed therapeutic interest in the use of plasma factor VIII. Using these results in economic modeling, some of which has also been done by eminent groups in Italy, has also demonstrated the cost effectiveness of plasma-derived factor VIII compared to the recombinant products, at least in terms of avoiding this complication. Next slide, please. And I therefore feel justified, since the CIPIT study has been so widely discussed, to share with you my views on its implications, which are convergent with others in the field. And given, as I said, that the production of an inhibitor is a catastrophic event in patients, any factor which may decrease it even marginally should be considered. Going back to sole use of plasma-derived products is not feasible, because we need the recombinant products in order to finally emancipate our community from the need to have insufficient supplies of factor VIII. Sufficient supplies can never be generated for the global community of adult people with hemophilia purely from the plasma supply. However, treating young infants with plasma-derived product over the first 50 exposure days, as has been shown in the CPIT study, should be feasible, after which patients may, according to therapeutic choice by the treater and the patient or his family, should be feasible. I propose that this strategy follows the basic medical principle of first do no harm, and is yet another example of the precautionary principle to which we have adhered in the blood field for many, many years. May I have the next slide? Can you please build up this slide? There are 3 components to the slide. Just advance the slide. Thank you. And the last one, thank you very much. Leave it there. To round off on factor 8, I would like to make you aware of the excess of riches we now have in the form of therapies. Time restricts from going these in the detail they deserve, but suffice it to say that the promise of molecular biology has been fulfilled, and we now have products molecularly altered to improve biological half-life, products which obviate the need for factor 8 itself, and very close to fulfillment, the promise of a final cure through the gene therapy. And I would emphasize that none of this would have occurred without the therapeutic baptism which started more than 50 years ago with the plasma product. And may I now have the next slide? And now we come to the current driver, immunoglobulin solutions, which are administered today in a variety of ways and concentrations. Can I have the next slide? The ability to concentrate immunoglobulin solutions and administer them intravenously has removed the problems associated with the first cone-derived immunoglobulin products in the 1940s and 50s, and has resulted in an explosive growth in the use of immunoglobulin in a number of conditions. Growth in volume and in price have been experienced. Immunoglobulin is what keeps us all in a living in this sector, and immunoglobulin is absolutely crucial to the economics of the industry, especially the ability to sell immunoglobulin to the good citizens of the United States, which have in that country a price which approaches double that in any other market, as you can see in this slide. May I please have the next slide? Following substitution therapy of missing immunoglobulin in patients with primary immune deficiency, known as PID, has resulted in a substantial improvement in patient well-being. These cohorts from different eras show that mortality has decreased steadily over the decades due to immunoglobulin treatment, as well, it must be said, to improved medical care overall. Can I have the next slide? Prossima. The finding of the therapeutic consequence of the immunosuppressive effect of large immunoglobulin doses in diseases such as the autoimmune neuropathies has led to this area overtaking PID in terms of the usage and hence economic importance of immunoglobulin. Here I show the conclusions of the latest Cochrane review in this area. Immunoglobulin is an effective treatment for these disorders, and ongoing research in the functional aspects of the Fc part of the molecule may well affect this in the future. And any changes, however, in the overall landscape may be expected to take some considerable years, and I personally do not expect the economics of the industry in terms of its dependence on IG to change dramatically over at least the intermediate future. I trust that that is a sufficiently qualified statement. Next slide, please. Other valuable proteins harvested from plasma for the treatment of congenital chronic deficiencies include alpha-1 antitrypsin and C1 esterase inhibitor. Clinical trials which have satisfied the regulatory authorities have led to the approval of these therapies for the relevant substitution of these conditions. Some tension still exists with the conventional evidence-based framework used by the Cochrane collaboration, but brisk sales and substantial profits occur for those companies fortunate enough to be able to put these particularly valuable products on the market. It must be emphasized that a higher demand can be expected based on the specified epidemiology of these diseases, but we still await the fulfillment of the promise of this substantial demand. May I please have the next slide, and I believe I'm approaching the end. So if I can conclude, Pierluigi and ladies and gentlemen, I think that the plasma therapeutics industry continues to grow and thus provide a number of important medicines. The evidence base for the use of plasma therapies ranges from the robust to the debatable, with chronic congenital deficiencies having unquestionably the highest level of evidence. The industry's current driver is immune globulin, the consumption of which continues to grow as a therapy for a number of autoimmune disorders. While alternative treatments to many plasma therapies have been developed, the financial sector appears to be confident in the plasma industry's at least medium-term future. Depending on which analyst you believe, this industry has a value of between $8 to $25 billion yearly, so I hope it will continue to yield benefits for the industry and, more importantly, for the patients which depend on it. And if I can have my final slide, which is the last slide, please, l'ultima, which is my acknowledgement to the Market Research Bureau, especially to Dr. Matthew Hochko, who supplied me with some slides which were presented at a previous meeting in Budapest in March. I want to thank you all for your attention and for your patience. I want to reiterate my thanks to the organizers. I want to thank the technical support in making sure that we have been able to communicate with each other today, and I reiterate all our thanks to the blood donors of Italy and of the world. Grazie a tutti per il vostro attenzione. I'll stay connected for any questions, and I also want to stay connected for subsequent talks until I need to leave to catch my plane.
Grazie. Quindi siamo partiti da questa analisi dei volumi di produzione, della appropriatezza dell'uso, delle prospettive di ulteriore utilizzo di questi plasma derivati e anche dei costi che hanno, per andare ora ad affrontare la questione della strategia rispetto all'utilizzo dei plasma derivati, e quindi come la valutazione del plasma come risorsa strategica. Abbiamo qui il dottor Stranger che ci parlerà ora di questo tema. Lo ringraziamo e diamo la parola.
Keep me connected. I want to hear what this man says.